Good evening, ma'am. And
Good evening.
good evening. And ma'am, I take this opportunity to welcome you and all the other doctors, who have joined us for this webinar on behalf of Hetero Healthcare. My name is Neeraj Parashar, the sales manager from Helion. Thank you, ma'am, and everyone to join us to discuss on Cariprazine, which is a novel antipsychotic treatment option for the patients suffering with schizophrenia. As you know about Hetero Healthcare, we have one of the largest R&D wings providing 360-degree solution to the pharmaceutical industry. Hetero has more than 25 years of excellence since inception in multiple therapy areas, wherein Hetero Healthcare has been present with 126 plus countries across the globe within its 36 plus state-of-the-art manufacturing facilities across the globe again, which helps in pioneering in quality as well as innovation in drug manufacturing. Also, to share, Dr. Hetero has more than 200 products across various therapeutic categories such as HIV, AIDS, oncology, cardiovascular, neurology, and few more, particularly with the distinction of bringing 4 biosimilar products to the pharma market here in India and across. So with this little brief about Hetero Healthcare, I would now like to introduce our speaker for the day. We have Dr. Priya Kaur, who is a gold medalist and a university topper in the year of 2022. Dr. Priya has done her MD from Government Medical College at Amritsar and has done her MBBS from Government Medical College, Amritsar. Presently, Dr. Priya Kaur is practicing in Amritsar and is a passionate psychiatrist currently, as I shared, working in the Department of Psychiatry at Guru Nanak Dev Hospital, Amritsar. Dr. Priya's interest in psychiatry stems from her early medical training, where she observed, that mental health often, has been taking a backseat compared to physical health. And the Dr. Priya was then driven to change that perception into the society. Her passion to treat psychiatric illnesses with empathy and expertise, enabling individuals to live a healthier and happy lives, has been the passion. Through her work, Dr. Priya aims to break the stigma which is surrounding the mental health in our societies and make quality psychiatry care available and accessible to all. With this brief about Dr. Priya, I would now request you to please kindly take over this forum and share your experience to discuss more on the subject, which is Cariprazine, a novel antipsychotic treatment for the patients suffering with schizophrenia. So I would now request you, ma'am, if you could take us through your presentation.
Thank you, Mr. Neeraj. Thank you for your kind words. Very good evening, everyone. We would be discussing Cariprazine today, a novel antipsychotic treatment option in schizophrenia. I'll go through my slides just a second. First of all, signs and symptoms of schizophrenia. Positive symptoms, hallucinations, delusions, disorganized speech and thoughts, and grossly disordered bodily symptoms. Negative symptoms like anhedonia, avolition, blunted affect, apathy, then impaired attention, concentration, cognitive symptoms like memory issues, inability to process social cues and to behave accordingly, impaired sensory perception, then difficulty in problem solving, difficulty in serial learning, difficulty in evaluation and monitoring. Symptoms of bipolar disorder, manic symptoms like racing thoughts, inflated self-esteem, extreme talkativeness, reduced need for sleep, feelings of euphoria, and risky behavior. Depressive symptoms like persistent low mood, fatigue, loss of interest in activities, lack of concentration, uncontrollable climb, and sleep and appetite problems. Discussing about antipsychotics first, the classification. First generation, typical, conventional, or dopamine receptor antagonist. This classification includes drugs like chlorpromazine, flupentixol, flufenazine, zuclopentixol, pymoside, and haloperidol. These drugs act as antagonists on D2 receptors, M1 receptors, H1 histaminic receptors, and alpha-1 adrenergic receptors. These drugs lead to high risk of extrapyramidal side effects, anticholinergic side effects like blurring of vision, constipation, then urinary retention, mouth dryness, antihistaminic side effects like sedation and weight gain, and antiadrenergic side effects like postural hypotension. Second generation antipsychotics or the atypical antipsychotics, also known as serotonin dopamine antagonists. This classification includes drugs like amisulpride, clozapine, lorazepam, risperidone, olanzapine, quetiapine, and paliperidone. These drugs are not only D2 antagonists, but they also act as antagonists on 5-HT2A serotonin receptors. These drugs decreases the risk of extrapyramidal side effects, but on the other hand has increased the risk of metabolic syndrome, diabetes, dyslipidemia, obesity, cardiovascular disorders, and ultimately premature death. Third generation antipsychotics, these are the drugs which act as D2 partial agonists. Depending upon the dopamine concentration, they can have antagonistic effects on dopamine receptors. They increase the dopamine in mesocortical pathways, leading to the improvement of negative symptoms, and further also decreases dopamine in the mesolimbic pathways, leading to the improvement of the positive symptoms. Examples of third generation antipsychotics are aripiprazole, brexpiprazole, and cariprazine. Coming to the side effects of atypical antipsychotics and which drugs are most likely to cause them. Weight gain and diabetes are maximum caused by clozapine, followed by olanzapine, quetiapine, risperidone, ziprasidone, and aripiprazole. Movement effects, example, tremors, stiffness, agitation, are caused maximum by risperidone, followed by olanzapine, quetiapine, risperidone, aripiprazole, and clozapine. Sedation and sleepiness, low energy, caused due to antihistaminic side effects of clozapine, olanzapine, and quetiapine, followed by risperidone, ziprasidone, and aripiprazole. Decreased libido, amenorrhea, galactorrhea, which is because of the hyperprolactemia caused by risperidone, followed by olanzapine, quetiapine, clozapine, and ziprasidone. Now, what are the limitations of the currently available antipsychotics? Overall response is not yet satisfactory. At least 40% of the patients don't respond at all. Limited efficacy on negative symptoms and cognitive deficits. The negative symptoms of schizophrenia, they not only lead to worse prognosis, but also leads to the long-lasting disease. They make the disorder less responsive to the drug treatment, and plus, they lead to greater functional impairment. A meta-analysis stated that only 4 second-generation antipsychotics, that is, the amisulpride, clozapine, olanzapine, risperidone, were better and more effective than the first-generation antipsychotics in treating the negative symptoms of schizophrenia. So what was the need for a newer antipsychotic? A drug with lower risk of sedation, extrapyramidal side effects, prolactin elevation, metabolic syndrome, especially can be used for a drug maintenance therapy, treat negative, affective symptoms, treat cognitive impairment, treat bipolar depression. So what do you think? Does cariprazine checks all these boxes? Yes, cariprazine, a broad spectrum DAPA, dopamine antagonist and a partial agonist, indicated for the use in patients with a wide spectrum of presenting symptoms. Cariprazine was most often prescribed for patients presenting with the first episode of psychosis in general, and these patients tend to be the younger patients. The first-line candidates for cariprazine are those with predominantly negative symptoms and those with metabolic syndrome. So FDA approved cariprazine for treatment of schizophrenia, not only acute, but also for maintenance of schizophrenia. Acute treatment for manic or mixed episodes associated with bipolar disorder, bipolar mania, and bipolar depression. Other than the FDA-approved indications, cariprazine can also be used for major depressive disorder with mixed symptoms or treatment-resistant depression, or as an augmenting agent in any type of depression for bipolar disorder maintenance. Also, there are many trials that are running for PTSD, behavioral abnormalities in children and adolescents. Coming to the dosage and the administration. Dosage forms and strength. Cariprazine is available in capsules of 1.5 mg, 3 mg, 4.5 mg, and 6 mg. For schizophrenia, the starting dose is around 1.5 mg per day, and the recommended dosage is 1.5 mg to 6 mg per day. For bipolar mania, the starting dose is 1.5 mg per day, and the recommended dose is 3.5 mg to 6 mg per day. For bipolar depression, the starting dose is again 1.5 mg per day, and the recommended dose is 1.5 mg to 3 mg per day. For major depressive disorder, as an add-on therapy, starting dose is 1.5 mg per day, and the recommended dose is around 1.5 mg to 3 mg per day. For schizophrenia and bipolar mania, dose should not exceed more than 6 mg per day. For bipolar depression, the maximum recommended dose is around 3 mg per day. It can be administered once daily because of the long T-half of cariprazine with or without food. Coming to the mechanism of action, cariprazine is a partial agonist at D2 and D3 receptors with significantly greater affinity for D3 receptors. It exerts partial agonism at 5-HT1A receptors, antagonism at 5-HT2A, 5-HT2B, and H1 receptors. It has minimal antagonism at 5-HT2C and 5-HT7 serotonin receptors and alpha-1 adrenergic receptors. There is no binding affinity at muscarinic receptors. Therefore, cariprazine does not lead to anticholinergic side effects. Cariprazine being a partial agonist at D2 receptors and D1 receptors with much more affinity for D3 receptors than the D2 receptors. It also acts as a partial agonist at 5-HT1A serotonin receptors. It acts as an antagonist at 5-HT2A, 5-HT2B, and H1 histaminic receptors. Due to its partial agonism at 5-HTTA serotonin receptor and antagonist at 5-HT2A receptors, because of this action, cariprazine increases the dopamine at the nigrostriatal pathway, which decreases the risk of extrapyramidal side effects with cariprazine. So being a partial agonist at D3 receptor, it improves the positive, negative, and depressive symptoms and also acts a pro-cognitive drug. It again is a partial agonist at D2 receptor and therefore improves the positive symptom. Being a partial agonist at 5-HT1A serotonin receptors, it improves the negative and depressive symptoms. And it acts as an antagonist at 5-HT2A receptors and therefore decreases the risk of extrapyramidal side effects. Being an antagonist at 5-HT2B, 5-HT2C, and 5-HTT7 serotonin receptors, it further increases the improvement in depressive symptoms and also act as a pro-cognitive drug. The partial agonist action at D3 receptors is around 10 times much more than the D2 receptors. The partial agonism at 5-HT1A receptors might enhance the dopaminergic neurotransmission in mesocortical pathways, leading to the improvement of the negative and the depressive symptoms. Coming towards the role of D3 receptor, it's seen that antagonism and partial agonism of D3 receptors leads to the improvement of social interaction, anhedonia, and has pro-cognitive effects. D3 antagonism at midbrain increases dopaminergic neurotransmission at prefrontal cortex and nucleus accumbens, which further improves and reverses the hypodopaminergic functioning, which is linked to the negative symptoms and mood deficits. Due to the increased dopamine at the prefrontal cortex, there is also activation of D1 receptors, which further improves the cognition and negative symptoms. The D3 receptors increases acetylcholine at the prefrontal cortex, which further regulates the glutamatergic activity. Cariprazine acts as a partial agonist at D3 receptors and D2 receptors at the ventral striatum, and therefore it decreases the positive symptoms of schizophrenia. It acts on the mesolimbic pathway and decreases the dopamine at the mesolimbic pathway, and therefore it improves the positive symptom. It increases the dopamine at the mesocortical pathway and therefore improves the negative symptom. Cariprazine acts as a partial agonist at 5-HT1A receptors and antagonist at 5-HT2A serotonin receptors present at dorsal striatum, and therefore it increases the dopamine here and leads to improvement, or there is very less risk of extrapyramidal side effects with cariprazine. Talking about the affinity for receptors. When cariprazine is compared with risperidone, both three drugs have very high affinity for D2 receptors, but on alpha-1 adrenergic receptors, risperidone has very high affinity for alpha-1 receptors as compared to cariprazine, which has minimal effect on alpha-1 adrenergic receptors. Therefore, anti-adrenergic side effects are much more with risperidone in terms of postural hypotension and sedation. The other two drugs, clozapine and olanzapine, also has very high affinity for alpha-1 adrenergic receptors and therefore increases the risk of postural hypotension and sedation. For olanzapine and clozapine, they also have very high affinity for M1 muscarinic receptors, and therefore they increases the risk for anticholinergic side effects like blurring of vision, dryness of mouth, constipation, urinary retention, which is not seen with cariprazine because it has no binding affinity with M1 muscarinic receptors. Talking about the pharmacokinetics of cariprazine, the oral bioavailability of cariprazine is around The oral bioavailability for cariprazine is around 52%. It has very high protein binding, that is around 97%. The maximum plasma concentration is around 3 to 6 hours. Cariprazine has a half-life of around 2 to 4 days. It has two metabolites by the name desmethyl cariprazine and didesmethyl cariprazine. The half-life of didesmethyl cariprazine is around 1 to 3 weeks. And because of this reason, cariprazine can be perfectly used as a once daily dose. And also it can be named as an oral depot because in near future, it would be for sure used as once a week dosing also. Cariprazine is metabolized by CYP3A4 enzymes, and therefore it should not be recommended by drugs which are CYP3A4 inducers, and the dose should be halved when it is given with CYP3A4 inhibitors. Key advantages of cariprazine: it leads to less weight gain. There is no significant increase in QTC levels. Once daily dosing because of long T-half, absence of prolonged titration periods, minimal anticholinergic, metabolic, and prolactin-related side effects, effective in negative and affective symptoms, effective in cognitive impairment. Now let's go through few of the clinical trials. In the patients of major depressive disorder, as cariprazine has depressive properties potentially due to its high affinity for D3 receptors, it has improved total scores of Montgomery-Ashburg depression rating scale as compared to placebo. It has also improved the remission rates and the response rate as compared to the placebo. There was another study which conducted with the outcome shown that cariprazine was a broad spectrum drug which improves the cognitive symptoms and negative symptom. It further improved the global functioning of the patients. In all clinical trials, cariprazine was generally safe and well tolerated in patients with acute and long-term exposure. Another research was conducted studying the role of cariprazine in acute exacerbation of schizophrenia. A multinational randomized double-blind placebo and active controlled trial was conducted. Patients were randomized for around 6 weeks. Placebo was given to around 153 patients. Cariprazine 3 mg per day was given to around 155 patients. Cariprazine 6 mg per day was given to around 157 patients. And aripiprazole 10 mg per day was given to around 154 patients. The primary and secondary efficacy parameters were mean change from baseline to week 6 on positive and negative syndrome scale total score and clinical global impression severity of illness score respectively. The outcome depicted that PANSS total score changed at week 6 significantly with cariprazine 3 and 6 mg per day in comparison to placebo. Cariprazine 3 and 6 mg per day were also associated with significant improvements relative to placebo on CGI-S scores. Study supports the efficacy, safety, tolerability of cariprazine 3 and 6 mg per day in patients with acute exacerbation of schizophrenia. Another trial conducted, which studied the role of cariprazine in the treatment of acute mania in bipolar 1 disorder. The primary and the secondary efficacy parameters were mean change from baseline to week 3 on Young's Mania Rating Scale, total score, and CGI-S scales, respectively. Outcome: cariprazine 3 to 12 mg per day was effective and generally well tolerated in the treatment of manic and mixed episodes associated with bipolar 1 disorder. Another study, which was done to study the role of cariprazine in the long-term treatment for the prevention of relapse in patients with schizophrenia. A randomized double-blind placebo-controlled trial was conducted, which had a duration of around 92 weeks. The primary efficacy point was relapse, which was further assessed by worsening of the symptom scores, psychiatric hospitalization, aggressive violent behavior, or suicidal risk. The trial concluded that around 48% of the relapse risk was decreased with the cariprazine. Only 35% of the patients taking cariprazine resulted in relapse, whereas 56% taking placebo resulted in relapse rate. Outcome: the long-term cariprazine treatment was significantly more effective than placebo for relapse prevention in patients of schizophrenia. Now, studying the adverse events and comparing cariprazine with risperidone, aripiprazole, and placebo. The rates of dropout due to adverse events was around 3 to 11% with cariprazine and 9% with both risperidone and aripiprazole. Extrapyramidal side effects were around 50 to 20% with cariprazine and 27% with risperidone. Sedation was around 6 to 10% with cariprazine and around 16% with risperidone. Akathisia was around 9 to 14% with cariprazine, whereas it was 9% with risperidone. The weight gain was around 1.8 to 2 kgs with cariprazine, whereas it was 1.9 kgs with risperidone. Cariprazine, placebo, and aripiprazole did not increase the risk of hyperprolactemia, whereas risperidone increased the risk of hyperprolactemia, amenorrhea, and decreased libido. There were negligible changes seen in heart rate, BP, ECG parameters, and lipids with cariprazine. There was only small increase seen in fasting blood sugar, that too at high doses of cariprazine. Now, on comparing dopamine receptor partial agonist, aripiprazole, brexpiprazole, and cariprazine, it was seen that 3 of the drugs had almost equal side effects. Only anxiety, sedation, insomnia, and impulse control was little more seen with aripiprazole as compared with cariprazine. All dopamine receptor partial agonists have similar efficacy in acute episodes. Comparable evidence of preventing relapse, aripiprazole and cariprazine were effective in acute mania. Cariprazine solely was effective in bipolar depression. Aripiprazole, both as a monotherapy and as an add-on therapy, was used for bipolar disorder maintenance and relapse prevention. Aripiprazole and brexpiprazole were used as add-on for major depressive disorder. Cariprazine alone was beneficial for negative symptoms of schizophrenia. Brexpiprazole was used as it had potential efficacy in acute agitation in Alzheimer's disease. Aripiprazole was effective in children, adolescents as an add-on on OCD, tics disorder, and autism spectrum disorder. Now, the implications of cariprazine for the use in liver disease. In case of mild to moderate liver disease, where the Child-Pugh score was around 5 to 9, there was no drug adjustment recommended, no dose adjustment recommended. But in case of severe liver disease, where the Child-Pugh score was around 10 to 15, use was not recommended as role of cariprazine was not studied in this population. Implications of cariprazine for use in renal disease. For mild to moderate renal disease, where the patient's creatinine clearance is more than 30 ml per minute, no dose adjustment is necessary. But in case of severe renal disease, where the creatinine clearance is around less than 30 ml per minute, use was not recommended as cariprazine role was not studied in this population. Now, summary of today's webinar. So the cariprazine is a less sedative drug. It leads to less extrapyramidal side effects. There was no change in QT interval. There was less incidence of hyperprolactemia. Anxiety is much less compared to aripiprazole. There were no changes in the weight gain. Better metabolic safety profile. High rates of relapse prevention. Effective against negative symptoms of schizophrenia. Effective against hostility in schizophrenia. Effective in relapse prevention in schizophrenia. Effective against manic and mixed states, effective in bipolar depression, and better alleviation of cognitive impairments than any other antipsychotics. Thank you. Any questions are welcome.
Thank you, ma'am. Thank you, ma'am, for taking us through your presentation. And now, ma'am, we will address the queries, ma'am, which have been coming, and we can see the first query, ma'am, which has come in. Like, what is the maximum dosage for cariprazine in any form of symptoms?
See, the maximum dose which has safe can be used is around 12 mg, 12 to 5 mg. But then the trials only recommended till 6 mg because it is safest. After 6 mg, the risk of extrapyramidal side effects and other side effects would increase. The safest dose is till 6 mg.
Okay, ma'am. Okay, so you suggest for 6 mg, ma'am.
Right.
Correct, ma'am. Correct. Another, ma'am, query which has come in is how we differentiate in terms of side effect profile when we are talking about aripiprazole as well as cariprazine, ma'am, comparing both.
See, I just showed up in my slides. As far as cariprazine and aripiprazole is concerned, maximum side effects are almost equal. But when it comes to anxiety, sedation, insomnia, and impulse control issues, it is much more much more with aripiprazole when compared to cariprazine. Cariprazine is on high edge with aripiprazole on these side effects.
Okay, ma'am. Okay.
Otherwise, both the drugs are equally potent, and then both the drugs can be used. Cariprazine and aripiprazole both work amazingly, but then side effect profile is equal almost. But then for these 4 symptoms, aripiprazole has worse effects than the cariprazine.
Correct, ma'am. That's the feedback which we are getting otherwise also. So ma'am, can it be given in positive symptoms is another, ma'am, query which has come in, patient with positive symptoms also.
For sure, cariprazine can also be given for positive symptoms. Cariprazine is a dopamine partial agonist. So it decreases the dopamine at mesolimbic pathway, and therefore it do helps in positive symptoms. And also because of its partial agonism at D3, D2 receptors, and plus because of its antagonist actions at 5-HT2A receptors, it does helps in positive symptoms. And partial agonism at 5-HT1A receptors also. It does helps in positive symptoms of schizophrenia also.
Correct. Very, ma'am, good query, which is another comment is like in MDD, what do you suggest, ma'am, as an antidepressant option, ma'am, along with cariprazine, ma'am, for the patients with MDD?
The choice of antidepressant.
Yeah, ma'am.
See, the choice of antidepressant, it basically depends upon the patient's profile. All the antidepressants, when we talk about the SSRIs, they are equally efficacy. The choice of antidepressants basically depends upon the patient's profile. We actually see the side effect profile of the drug and the patient's profile and then decide the best antidepressant that would work. Then it can be used with SSRIs and SNRIs as the trials suggest. It has been used.
Correct, ma'am. If you want to make it more specific, ma'am, like, can I ask you about your clinical choice of the antidepressant, ma'am, if you have to use it?
See, I think it has worked wonders with duloxetine as an SNRI.
Correct.
Right? And then again with sertraline or probably with escitalopram, it has worked wonders.
Correct, ma'am. So also, ma'am, something which has come up and very frequently, I also keep, having these queries is, can, ma'am, cariprazine replace aripiprazole?
See, I would say it has already started to replace aripiprazole. Because of the, it is improving the side effect profile because of the 4 symptoms I mentioned as far as the insomnia or anxiety or the, aripiprazole is much more an activating drug. So it is already replacing aripiprazole, and plus the side effect profile of cariprazine is much better. And then the dosage profile is also better as it has long T halves, and therefore I guess it is replacing, and it would really replace it more in coming future.
Okay. So another interesting, ma'am, question which has come up is in acute exacerbation of, ma'am, schizophrenia, do you suggest cariprazine to be used alone or as an add-on, ma'am?
The cariprazine can be used both as a monotherapy and plus also as an add-on therapy.
In acute cases, ma'am, what do you suggest?
Acute cases, see, I would say the trials have been conducted where it is used as a monotherapy also. But because being a newer drug and not much of the clinical practice is there with the practitioners, it is obviously not really the choice as a monotherapy, but then it can be used. Fewer patients have responded really well with monotherapy also.
Right, ma'am. Right. I think, ma'am, we have addressed it already that can we use aripiprazole instead of cariprazine? So I think you have already answered that. So coming up to the next query, ma'am, like what is the most common side effect of cariprazine, ma'am, if any you have seen? And if you can share with us.
The most common, I guess, I have not seen much of the side effects, but then the most common I have seen in my clinical practice would be akathisia.
Correct, ma'am. So that is, something which is reported in papers also. So, ma'am, further, from my side, like if I ask you, how can, we control the akathisia, using this drug itself? Is there any way, ma'am, we can even control this proportion or percentage of occurrence of akathisia in your patients?
See, akathisia can be controlled. Benzodiazepines can be used. Long-acting benzodiazepines can be used. They work wonders for akathisia. And plus, drugs like mirtazapine and cyproheptadine, which are 5-HT2C antagonists, they also work wonders for akathisia
Correct, ma'am. And
when
ma'am,
they added on with the cariprazine, for sure.
any ma'am, sexual side effects, ma'am, particularly in young patients, ma'am, if you have seen reported with cariprazine?
No, as of now, I've not seen any sexual side effects. That is the positive point with cariprazine. It doesn't lead to prolactinemia. Therefore, it doesn't decrease the sexual drive when
Okay,
compared
ma'am.
to the second generation antipsychotics.
Right, ma'am. And how about, ma'am, like in pregnancy, ma'am, is there any reference or the document, ma'am, that can the drug be used during the patients, having the pregnancy with them?
For sure, because of the ethical reasons, much of the trials are not conducted on the pregnant females. But then some of the females who were already taking cariprazine and then they conceived, not much of the side effect or not much of the effect was seen in the neurodevelopmental development problems were not seen in the neonates, not seen in the infants. So it is taken as a safer drug in pregnancy also as of now. Like any other antipsychotic, you have to just take care that you don't have to, better not to switch the drug or discontinue the drug. It is better to continue cariprazine if it was already initiated before the pregnancy. And if you continue the same drug, you don't switch the drug, you don't discontinue the drug, there would be much lesser chances of neurodevelopmental issues in the newborn and
Okay.
much lesser chances of relapse in the mother also, the pregnant female.
This is something which is important for us to know. And how about, ma'am, use of cariprazine in adolescents, or what is the minimum age, ma'am? If there's any minimum age bar, above which only we should be considering usage of cariprazine.
See, as of now, there is no designated age given as the minimum age for which it can be used. In this sphere, aripiprazole is, I would say, a better drug because we have used it in neonates also, and then for autism spectrum disorders also, and
Okay.
then tic disorder, and then again, I would say an OCD in children. Cariprazine can be used in children and adolescent, but then we have to be very cautious because in children and adolescent, if it is using as an antidepressant, it might increase the risk of suicides. So it has to be taken care of in children and adolescent group. Otherwise, it can be used in minimal effective dose and with little, cautions. That's it.
Correct, ma'am. Correct. Okay. Another, ma'am, query which comes in is like, for the patients, with a cardiac history, which, ma'am, like antipsychotic you would recommend? And would you recommend, ma'am, cariprazine also along with any other antipsychotic? How do you go about, ma'am, for such cardiac patients?
See, I would say for cardiac patients, the second generation antipsychotics, they're already, increasing the side effects at metabolic profile, metabolic side effects at very high rate. Therefore, the third generation antipsychotics, specifically, I would be talking about cariprazine, can be used in cardiac patients, and because it does not even increases the QTC prolongation, and plus it only increases the blood rate, blood pressure, and heart rate at a very high dose. So if it is being used with caution, it can be prescribed in patients with cardiac disorders as compared to second generation antipsychotics.
So, ma'am, as you mentioned, in the high dosages, there could be a risk. So, the recommended dosage, ma'am, which ideally is suggested is 6 mg, which you shared also. So,
Right.
at 6 mg, ma'am, any such cases you have come across?
No, not at 6 mg. When I talk about high doses, I talk about more than 6 mg, which is not recommended doses usually
Correct,
because
ma'am.
of
So,
these side effects only.
correct, ma'am. So, ideally, ma'am, up till 6 mg, it is, which is the recommended dosage. There are no such episodes which have been reported.
Very
Correct.
rarely seen. Very
Correct, ma'am.
rarely.
And ma'am, has cariprazine, ma'am, in your clinical practice caused any hyperglycemia in any of the patients?
No, it hasn't. It has a very, I would say, very less risk to increase fasting blood sugar, and that too, again, at a dose much more than 6 mg.
Okay, ma'am. The another query, ma'am, we have already answered. I think you have addressed it about its usage in adolescents and children. So that's there. Once again, ma'am, a similar query which has come up is cariprazine different from aripiprazole. So I think, ma'am, you shared, it is on the basis of the side effect profile. Cariprazine scores over, aripiprazole, or is there any, ma'am, parameter also where you would suggest or prefer using cariprazine, ma'am, compared to aripiprazole?
See, in comparison to aripiprazole, I would prefer cariprazine in patients of bipolar depression. Then again, aripiprazole work wonders, but then there are specific disorders for which cariprazine is more preferable. That is bipolar disorder, or in patients with negative symptoms of schizophrenia, or in patients with cognitive symptoms. Cariprazine would work much better as compared to aripiprazole.
Correct, ma'am. This is a little, ma'am, I need to understand the query, but I think, ma'am, it would be, it's relating to the weight gain in patients. I think would be, in terms of usage of cariprazine. So I think, ma'am, weight gain, it was, how do you see, ma'am, like in your clinical practice? Does it causes weight gain, ma'am?
Cariprazine does not lead to weight increase. It is that is the reason it is different from the second generation antipsychotics. The side effect of weight gain with cariprazine is much lesser as compared to second generation antipsychotics. And but then again, with weight, there is another thing we have to keep in mind. There are some studies which suggest that if the weight of the patient is less than 63 kgs, we should be using cariprazine in the minimal effective dose. That can another be, an add-on thing for the weight and cariprazine relation.
Wonderful, ma'am. Wonderful. And how you consider, ma'am, cariprazine as a first-line treatment for patients with schizophrenia?
See, according to the trials, cariprazine is working really well in acute exacerbations, and plus also it is working really good for patients whose side effect profile, we don't want metabolic syndromes, or we don't want hypertension, dyslipidemias, or diabetes, or patients who are already obese or who have high cardiac side effects. So for using in such patients, cariprazine can actually be used as a first-line treatment for acute schizophrenia and also for the maintenance.
Right, ma'am. That really helps, ma'am. Okay. So, ma'am, again, similar question like, usage of cariprazine with patients with impaired cardiac function. So, in your reported cases, ma'am, in your clinical experience, ma'am, I think as you have shared, if we are going to the recommended dosage, there are no such adverse events, ma'am, you have seen.
Right. No such adverse events. Till the dose is prescribed is 6 mg, and then again with caution.
Right, ma'am. Right. And ma'am, how's you see, ma'am, cariprazine performing in elderly patients, ma'am, on various aspects, ma'am, like uh, the efficacy as well as the side effect profile, ma'am.
See, I would say as such, there is no contraindications for cariprazine in elderly population. But then again, similarly as in children and adolescent, we have to be very cautious in elderly. The dose has to be the minimal effective dose, and that too, the increments of the dose should be much slower as compared to the adult or to the youth population and middle age group. Otherwise, cariprazine can be used, but then it has to be used with caution. But for dementia and other disorders, like for dementia or different types of dementias in elderly patients, cariprazine can be used, but again, then it is not recommended that much because it can lead to sudden deaths
Okay, ma'am. That's
in
an
in yes
important.
in patients of elderly age group, right?
Correct. And anything, ma'am, on missed dosages, in terms of patient undergoing treatment and having cariprazine.
I would say because of the long T half, Even if the dose is missed, like if the dose is missed and the patient remembers it within 1 or 2 hours, the patient is advised to immediately take the dose. But then if the patient has missed the morning dose and then he kinds of, remember it around evening, then the patient is not recommended to take the morning dose. He can surely take the night dose itself, if it is being given in the divided doses, and then continue the next day morning dose or the BD dose as it is prescribed. Because of the long T half, as such, missed dose are not much a problem with cariprazine.
Okay, ma'am. Okay. And how do you see, ma'am, like use of cariprazine, if there is any, in patients with anxiety or bipolar? Bipolar, yes, ma'am, you can speak, I think, something and give your input, but otherwise also in anxiety, ma'am, somebody wants to know.
See, in bipolar disorder, cariprazine is working really well in bipolar disorder, bipolar depression, then acute mania with mixed symptoms. Then again, there are trials going on in bipolar disorder maintenance. It is not an FDA approved indication, but then again, it is being used in bipolar disorder maintenance also. But then, as far as anxiety disorders are concerned, as such, it is not being used currently, but then again there are some trials that are going on for generalized anxiety disorders, and again for PTSD. Probably in coming future we come up for these disorders as well, the use of cariprazine.
Correct, ma'am. So, ma'am, if I can ask you, in your clinical practice, ma'am, did you try it for any patient with anxiety?
No, not yet. As of now, not yet.
Not as of now. So,
No.
so right now, ma'am, there's nothing as such you recommend for cariprazine usage for patients with anxiety.
I guess no, there is no concrete evidence for anxiety use, but then again, maybe the trials are going on, maybe in future.
Right, ma'am. Right, ma'am. So I think, ma'am, there have been a lot of queries, and ma'am, you're really, very supportive in terms of, addressing them. So with this, ma'am, I would like to really thank you for your informative content, which is well received actually. And I surely believe, ma'am, that it would contribute significantly for the use of cariprazine, for the patients suffering with schizophrenia. Ma'am, we're truly actually grateful for your willingness, to share your knowledge and expertise with us, on the subject, which is cariprazine in treatment of schizophrenia. And your presentation, ma'am, was very enlightening, and we are confident that, the audience would be benefited greatly in terms of, ma'am, the insights which you have shared of how to use, ma'am, and how to evaluate the drug in different indications and different kind of patients. So with this, ma'am, I really thank you for your time today, and we look forward, ma'am, in times to come for such webinars on cariprazine and, ma'am, other newer products, ma'am, for which Hetero is very committed to come in times to come. Innovative products, ma'am, and innovative formulations. So I'm really thankful, ma'am, and hope to see you very soon again for such platforms. And the other queries, ma'am, which come, post the webinar, I would definitely, ask my team to take it up, and we'll take your input and we'll share it with the respective person. Thank you, ma'am, again for taking time.
Thank you, Mr. Neil. Thank you so much.
Thank you.
Thank you so much.
Thanks a lot. Thank you.